Well, as the casualties from the outbreak of meningitis continue to rise in parts of northern Nigeria, the Zamfara state government has intensified efforts to curb the scourge, while the state government is appealing for more support from the federal government and other development partners whom they acknowledge have stood solidly behind them since the first case in the state was recorded last year. TVC News' Suleiman Nasir reports.
First outbreak at Gora Ward in Birnin Magaji local government area of Zamfara state. A total of 2,450 cases of the bacterial cerebrospinal meningitis (CSM) has been recorded in the state. This has resulted in the death of 269 persons. An emergency has been declared, with the three tiers of government collaborating with development partners to contain the scourge. Zamfara state is the worst hit in the country and has become the epic battle center, with the federal government deploying man and equipment to the state in a bid to tame and prevent a countrywide epidemic.
We're on top of this outbreak. This outbreak cannot man Nigeria. It cannot determine the future of Nigeria. We can determine the outcome of the epidemic. We're on top of it, and we have all the necessary materials to tame the epidemic.
The central theme in this outbreak has been the availability of vaccines. And I want to put on record that the vaccines are available.
Many have died. Several others are battling to survive, while vaccines are in short supply. Governor Yari took a tour of the most affected communities to provide the needed encouragement and support to the victims of the strange type C virus.
We require over 300 million doses of vaccine, but we got only about 300,000 in the last consignment, which was only about 10% of our total requirement.
The governor was not pleased with the standard of treatment he found in many of these communities and promised to ensure standards were drastically improved.
The environment itself is required can't be up to standards. And part of the instruction given by myself to the committee is to make a hygiene and a standard place where the patients are going to be.
Zamfara state need over 3 million doses of the type C vaccines, but presently only 300,000 are in supply, a situation that has limited care given to only 10 wards out of the 147 wards in the state affected with the disease. Suleiman.
Well, Ehi Iden, an occupational health and safety manager, joins us now live to discuss the meningitis outbreak in northern Nigeria. Good to have you with us on TVC News Hour. Well, let me start with this. This is not the first time Nigeria has recorded meningitis outbreak. We've had series of this in some parts of the country, but the level at which it's being managed is the question on many Nigerians' lips. Why do we have to wait before it gets so bad, before we call for help?
That's the question we are all asking. We've had this scourge always affect us in this meningitis birth region, and it's not the first, not the second, it's not the third. But we are not too happy with the level of preparedness. If we know that this lives with us and is part of our system based on our temperate region, we should have a system or a program in place to actually curb meningitis. When meningitis is properly managed, you always have about 15% fatality, incidence. But the way it's going right now, you can hear the news that was being read out. A state needs about 3 million doses. They have just about 300,000. That's about 10%. We should have these vaccines available at all time. Not just that alone. Make information available to people at all time. People can only manage their head to the degree of information they have at their disposal. And this is an area where we find we're not doing this thing right, because we wait for things to happen before we start looking for how to tell people, train people on what has gone wrong. But when we give them information beforehand, so they see the first symptoms as it's happening, they're able to remember, okay, this is what we're told, and they blow the whistle early enough so we can have enough quick intervention to actually combat this scourge.
All right, yesterday the health minister said Nigeria needs $1 billion to immunize 21 million people. How far can this go? Will this solve the problem?
Well, it's just to immunize, which of course immunization is the best approach to it. It will go a long way in solving the problem. But when you immunize these people, and the actions we need to also create, like having what we call a national program on meningitis control. We don't have that. Campaign. Yes, awareness and advocacy. I also have a program. If the program that the country has is what we should do, what we should look at for, what is the country's plan to combat this thing when they happen, but we don't have such plan. Now what we are doing now is what we always do. We are going through the fire brigade approach, looking for money. When this thing fizzles out, now we are back to square. When we had Ebola with us some time ago, everybody became up and doing, we fought it, and now it fizzled out. Nobody hears anything about Ebola anymore. When it comes again, we go to the same circle. I just think this is not the best way to approach this thing. The earlier the government comes on board and comes to the party to actually have programs that actually combat these diseases, infections, that you know that they are like part of our system, they will surely come, the better for everybody. And
some analysts, some health experts rightly put that the poor health system in Nigeria contributes to some fact, to some level, you know, of the way we respond to this kind of disease and cases that arise. But if the health system is a problem now, don't you think that the government needs to do more in terms of, you know, revisiting the health system, ensuring that it has the necessary equipment to handle this kind of situation? We
have been canvassing for that for too long. Even one.org has taken this campaign up on healthcare system in Nigeria. We are not happy the state it is right now. And we have a lot of professionals who are even in diaspora. They've actually learned their voices. Let's see what can do by Nigerian healthcare system. When you see few people canvassing for what actually will profit the generality of the public, and it looks like you are fighting for your own personal interest, it becomes a problem. Government has to come to the party as it concerns, because when you look at every stakeholder in this game, they're looking up to government. Government is the key stakeholder. But when government does not actually drive a program, we all plug into the program that government actually put in place. But we are not seeing such proactive programs for people to plug into to ensure that we're able to actually assist them in every way necessary.
Now, you've talked about being proactive, and you talked about government. You can't let everything in the hand of government. What is the state governments, what are they doing? Because we know that this comes around this time of the year. Add that to the fact that the governor of Zamfara State was complaining that the drugs that are being sold, the drugs meant for people, are being sold to them.
Sure.
How come?
You know, one of the things, I come to that, one of the things government should have done, because we actually identify the states where this happens every time in the country. We should take up the information level, health literacy level within these states. And outside that, I haven't done that, then the drugs that you know that are needed to actually combat these things should be made available. Like now there's no case, I mean, Edo State and other states within that region, there haven't been any case. But we know the region where these cases are, but the vaccines are not available. But government should make this available at all time, even before the scourge comes in. But this is not happening. Now you find out that states that don't have such issue, they have the vaccine. But states that have such issue, they don't have the vaccine. So if people crossing over to go and look for vaccine, just for the
I wish we had all the time in the world, because we really talked about that, the fact that government said this took them unawares, you know. But
well, we just have to thank you very much, Ehi Iden, an occupational health and safety manager, for your contributions and, of course, enlightenment on the News Hour.
Thank you very much. My pleasure.